Okay, so as we have mentioned before, that if they ask you to examine the neck, you are going to examine the neck, you are going to find the thyroid, and you are going to find the lump, and that's it. Okay, but if they ask you to examine the thyroid of this patient, or the thyroid status, and thyroid status, you have to add the status. So in the last lecture we finished the thyroid examination in the neck, thyroid gland examination, and now we are going to check the status. So what are you going to examine in to know the status of the patient? Status is to know if the patient is hyper or hypothyroid. He has hyperthyroidism or hypothyroidism. So the first of all, you are going to start with the hands. Okay, this is the first thing to check. And what are you going to check in the hands? Number one, you are going to check the pulse, radial pulse. Okay, this is the first thing. The second thing that you want to test here is that you are going to examine for tremor. Okay, so these are the two things that you are going to find out in the hands. So the radial pulse, if the patient is hyper, you are going to find the patient tachycardic, and there will be a large volume. Okay, and if he is hypo, you will find the opposite. For the tremor, you are going to ask the patient to extend his hands, okay, arms and hands, okay, and you are going to ask him to fan his fingers out in front of you, and you are going to put a paper, okay, a piece of paper, and that paper will show you if the patient is has tremor or not. The paper will start to flicker or something like that. You will see the tremor on the paper. It will be so apparent. So this is the first point here for the hands. So the second step that you are going to in which you are going to check for the status is you are going to examine the eyes. Okay, is the second thing you are going to examine the eyes. And in the eyes we have two things also to see. Number one, we want to examine for the for exophthalmos. Number one. Number two, we want to examine for lid lag. And number three, we want to examine, there are three actually, we want to examine for the eye movement. Okay, fine. So you have three things to test in the eye. So for exophthalmos, you are going to look at the patient's eye or face from behind. Suppose that this is his eye, his exophthalmos, this is his forehead here. Suppose you are you will come from behind and look from up. So in this way you can see this protrusion here. Okay, so if you see it, this is exophthalmos. Second, the lid lag. So how can you examine for the lid lag? The lid lag simply that there is a delay of the fall of the upper eyelid when the patient looks down. That's it. Okay, so you are going to put your finger up for him in front of him, and ask him not to move his head, and ask him, please follow my finger with your eyes only. And when you drop your finger down, his eyes will go down. Normally the eyelids should go down with the eye, but in lid lag there will be a delay. The eyelid will be up, and the white part of the eyeball, sclera, will be so apparent to you. So there will be a delay in the eyelid drop. So this is lid lag. Okay, the third point is the eye movement. You are going to stand in front of the patient, asking him not to move his head, and make an H letter by your fingers in all movement axes. Okay, so if you feel that there is any problem, you are going to ask him that if you felt double vision or something like, or pain, for example, please tell me. And in this point here, if there is any pain or double vision, or there is restriction of movement that you can see, okay, so at that point you are going to consider that patient as having a restriction of eye movement. Exophthalmos, lid lag, and eye movement are all lead like an difficulty in eye movement or restriction or pain or double vision. All these are for hyperthyroidism. Okay. Well, the third thing that you are going to do to finish your thyroid status examination is that you are going to examine the legs. Okay. And in the legs, you are going to examine for some points. And these points are as follows. Number one, you are going to examine for what is called peritibial, or pretibial actually. It is pretibial, not peritibial. Sorry. Pretibial myxodema. Okay. Myxodema. Okay. Number two, you are going to examine for ankle reflexes. Okay. Or ankle reflex. And number three, you are going to examine for proximal myopathy. Okay. So these are the 3 points that you want to examine in the patient in a thyroid status or a thyroid station. Okay. So let's go here for pretibial myxodema. This is a swelling, as you know it. Most probably you have seen it in some books or in the internet. Some ugly swellings at the tibial area, especially at the shin and at the anterior anteromedial aspect of the leg. Okay. Usually the patients who will be seen in the exam will not have this. Okay. This is the first thing. The second point, this is a sign of hyperthyroidism. Sorry. The second point is the ankle reflexes. So you are going to make the ankle reflex. You are going to ask the patient to kneel on the chair, facing his face is in the opposite side. You see, he's actually, instead of sitting and facing to the front, he is going to put his knees on the chair and facing to the back. Okay, so his ankles and feet will be free, and at this point here you can do the reflex. And if you find it exaggerated, so this is hyperthyroidism. If it is slow, it is hypothyroidism. Okay. Finally, the proximal myopathy. Proximal myopathy is a weakness in the proximal muscles of the body, involving the upper limbs and the lower limbs, but it is more apparent at the lower limbs. So you are going to ask the patient to please put your hands or arms in front of your chest, that he will not use them to stand, and stand without their support. If he can stand, most probably he has no myopathy. And if he couldn't stand without the support of his hands, most probably he has proximal myopathy. And it's a sign also of thyroid hyperthyroidism. Last thing to mention here is that some people will mention something called Mixodemous Phase, that face with thick skin, and it is emotionless and cold and so on. So actually this is not usually required, and most probably you will not find time for it, but you can mention it if the patient is myxomatous and it is so clear, which is uncommon in the exam. So you can mention it if you want. But these 3, hands, eyes and legs, are the 3 points. So in the next lecture we are going to show the questions and the discussion about this station. Thank you very much.